Hello, and thank you for joining us for the first mental health parent and community virtual in-service of the 2020-2021 school year. My name is Vicki Odell, and I am the Director of Pupil Services for the White House School District. This video is in coordination with the school districts of Arcadia, Blair Taylor, Independence, and Whitehall. I would like to thank those of you who took the time to complete the survey regarding topics of interest to you in the areas of mental health. Each of my colleagues will take a few moments to introduce themselves and talk about mental health services offered at their specific level in our district and in the community. First, I would like to address a top question that was asked by many parents in all 4 of the school districts. Many of you wanted to know during these challenging times how districts are meeting the mental health needs of students who are attending virtually. All of the resources which will be shared with you in our district videos are available to each and every student, regardless if the student attends virtually, in person, or a mixture thereof. Each district offers in-person school-based counseling as well as virtual school counseling. If your child attends virtually and you would like them to meet with a mental health professional in your specific district, please call your child's building-specific school counselor. The counselors and psychologists are more than willing to meet your needs. Please make sure that you call ahead and ask specifically if the school has gone virtual. Each district will make every reasonable attempt to meet with your child. If your child is experiencing a mental health crisis, we will work together with outside agencies to get you the assistance you need. I will now turn you over to the Pupil Services team, with the exception of Becky Polis, our school nurse, who you will hear from when the nurses address issues regarding COVID. Again, the Whitehall team will be talking about district and building-specific community services available to your child to assist with mental health issues. We will be posting all of our resources as we speak about on the district webpage. If you have any questions, please feel free to call me at 715-492-0159.
Hi, my name is Courtney Stearns, and I'm the school psychologist at Whitehall. I work with students age 3 all the way up through grade 12. One part of my job is working with students and families in special education. I consult with teachers and families around academics, behavior, and social skills. I also support mental health by working closely with the counselors, school staff, and families as needed to respond to daily mental health needs, students in crisis, and also helping to refer students to outside providers. I meet with online students or parents virtually or via phone as needed. So I'd like to tell you about some resources that are available in our community that are available through the county. So the first one is called Children's Long-Term Support, which is also known as the Clts Waiver program. This is a voluntary service for children with significant developmental disabilities, emotional needs, or physical disabilities. Eligibility is based on needs and a financial assessment. The next program is Birth to 3. This is a program for children ages birth to 3 who have a diagnosed condition or a developmental delay. The areas of development that they evaluate include cognition, physical and motor skills, speech and language skills, social and emotional development, adaptive skills, or sensory concerns. The last one I'd like to tell you about is called Comprehensive Community Services. This includes services that can help those that need ongoing comprehensive services. So case management, inpatient, and outpatient services. You can find more information by our posting or more information on your county's website or by calling the Human Services Department. Thanks, everyone.
Thanks, Courtney. Hi, my name is Becky Briette, and I am a Director of Special Education Pupil Services Practicum student. I currently work for the Whitehall School District as the Speech and Language Pathologist. Vicki Odell is my Practicum Supervisor as the Director of Special Education. The main role of a Director of Special Education is to serve as the school district lead representative and contact person of programs for special needs students. The director collaborates and coordinates with the principals and the other staff to provide services to students with special needs. I would like to share with you some of the resources that can be found in our surrounding communities. The first resources are for families with children with autism. The first resource is the Wisconsin Early Autism Project, or WEAP. This is an ABA therapy services program whose goal is to provide services to help children with autism to reach their full potential. The closest WEAP program is out of Eau Claire. Another autism resource is Reaching Your Potential. Reaching Your Potential is a home-based program that provides positive interventions for children with autism spectrum diagnosis. Their goal is also to help each child reach his or her own potential. Reaching Your Potential is out of La Crosse and have helped many families within our district. The next resource is an option for families with students with significant behavioral needs. This resource is a day treatment center as part of the Northwest Journeys. Students generally enroll for approximately 8 to 12 months, and the school coordinates care with day treatment. They offer family-centered counseling, and most of the students' day is therapy-related activities. In the Whitehall School District, we have the option for students to receive their medications at school. If you are interested in having your child receive their medications at the Whitehall School District, you would contact Nurse Becky Polis, and she would help you navigate through the process. Thanks, everyone.
Thank you, Becky. Hello, my name is Laura Eide, and I'm the high school counselor in the Whitehall School District. I am one of 3 school counselors in our district. As school counselors, we provide services to all students within the district in regard to career education, academic success, and personal and social growth and development. We facilitate this growth through classroom lessons, small group meetings, and individual meetings. These lessons and meetings happen both virtually and in person. We help students develop strong organizational skills, study skills, interpersonal skills, and coping skills. We work with students on ways to identify their feelings and manage their feelings. We assist them with developing interpersonal skills so they can create meaningful relationships with their family and friendship groups. We also can be effective in assisting students with some mental health issues, such as daily management of anxiety and depression. If a student comes to us and is in need of more support due to trauma or past life experiences, we have the ability to refer him or her to a counseling agency with trained staff. These staff are experts in helping individuals with more significant needs that school counselors are not trained to handle. The Whitehall School District currently works with 2 outside agencies to refer students for more in-depth, individualized counseling. The first organization is Peace of Mind out of the La Crosse area. We have been partnering with Peace of Mind for the past 5 years. Kayla and Holly are from Peace of Mind, and they are in our building every Tuesday to meet with students. If parents are interested in setting up their child with a counselor from Peace of Mind, please contact the school counselor in your child's building, and she can get you everything you need to get this set up for your child. The Center for Resilience and Healing and Independence is another agency we have been working with to refer students for individual counseling. Valerie is the owner and therapist. Valerie is willing to meet with your child in person, in her office, virtually, or she'll come to our school building and meet with your child. The benefit to the counselor being in the building is that your child does not need to travel to a site and the parent does not need to take off from work. Valerie has expertise in trauma-informed care, anxiety, chronic stress, and play therapy for younger children. She's open to meeting with groups of students, doing parenting groups, and using a sliding fee scale as needed. She currently can accept medical assistance, Badger Care, Blue Cross Blue Shield, and Alliance insurance. The Whitehall School District also has an agreement with Purveya for mental health teleservices. Purveya is working out details with the state of Wisconsin to offer services to Whitehall students. We will post this information on our website when Purveya is ready to begin teleservices. Thank you very much.
Thanks, Laura. So my name is Taylor Gibson, and I am the 6th through 8 counselor here at Whitehall. In my role, I typically meet with students individually and in small groups, and I also teach a class at all 3 grade levels that we call wellness. Oftentimes when I meet with individual students, it is on a weekly basis or on an as-needs basis. I also will hold small groups if there's a common issue that students are facing, where we get together and discuss the issue and support each other along with a few activities to help understand and cope with the issue. For example, if a group of students are experiencing or have experienced a divorce or grief, I'll put together a group of students, and so that way we can support each other that way. This year has changed counseling slightly, with some students being virtual. When I begin seeing a student, I will typically send a Google Calendar invite that will repeat weekly, and it'll have a video link attached. So this will work for students who are both in person and virtual. That way, if a student does have to go to virtual for whatever reason, we'll easily be able to connect. I also send frequent emails to these students to remind them of our meetings, and I'll put the link right in there as well. So there's multiple places that they could get that link. I teach both 6th grade wellness, and then there's a new elective class, 7th and 8th grade level, called wellness. It is required this year, and we added it as there's a high need of mental health issues in children and teens. And it is a 6-week long course that is 4 days a week for 45 minutes. 6th grade wellness is no different than any of the other wellness classes that they receive in elementary school, so preschool through 5th grade. And they receive my class 30 minutes every 6 days. In all levels of wellness, we discuss topics such as different mental health illnesses, suicide prevention, peer pressure, drugs and alcohol use, internet safety, and so on. Towards the end of 6th grade, we do go over topics that will help prepare students for their transition to the middle school. So for example, we'll be practicing locks on lockers, what to expect in their classes, who their teachers will be, and so on. Just like all the other classes, they are able to connect virtually and learn that way. Thanks.
Thank you, Taylor. My name is Bethany Bowen. I am the elementary school counselor at Whitehall. I serve students in preschool through 5th grade. And as elementary school counselor, I meet with the students to assist them with social, emotional, and academic concerns. I typically meet weekly with the students or as needed to work on social skills, building coping skills, expressing feelings and needs, and other activities and skills that the student is needing. For students who are currently learning from home, I'm able to meet with them over the computer for our sessions together. Students, parents, and teachers are able to reach out to the school counselors regarding any more assistance needed for their students that are in person or virtual. Another role of the school counselor, like Taylor mentioned, is the small group counseling support. If there are multiple students that are struggling with a specific topic and feel like they need more benefit from talking about it and receiving support from other peers, we will have them be a part of our small group sessions. Some of these topics that might be relevant for in the elementary school are friendship, loss, worry, time management, and many others. Students that are currently virtual could also benefit from these groups. Another big part of the role of the elementary school counselor is implementing classroom lessons. At Whitehall, like Taylor mentioned, we call them wellness class. During wellness, students learn about various topics and have the chance to practice these skills and discuss things that the students might need some more guidance or assistance with. Some of the topics include managing and identifying feelings, problem solving, career exploration, bullying awareness, decision-making, and many others. Lastly, another big part of the school counselor's job is to join the student meetings to offer support and ideas to best help your students, of those who are at school and those who are currently learning from home. Thank you.
Hi, I'm Katie Anderson, and I am the elementary school counselor. I can be reached by phone or email. My contact information is found on the district website. Mental health services offered at the elementary school include social emotional curriculum 3 times a week for students 4K through 4, which allows students to practice social emotional skills that will hopefully benefit them in the future. I teach guidance, which is supplemental to the SEL curriculum provided in their classrooms. I teach guidance once a week to kindergarten and 1st grade, and monthly for students in 2nd through 4th grades. Depending on the needs of the students, I also provide individual and group counseling. If students need additional support, community health providers are available to see students individually at school. Remote students can reach out to me through their teachers and/or parents. Then a phone call and/or Google Meet with the students can be set up to meet with me.
Hi, my name is Mary Nelson, and I am the Arcadia Middle School counselor. You can call and email me at any time. My contact information is on the district website. Mental health services that are offered at Arcadia Middle School include a healthy behaviors class that I teach to all fifth grade students. The class includes mental health topics and skills. Grades 6 through 8 will be receiving social emotional learning lessons during homeroom starting in the second trimester. All of the lessons will touch on mental health issues concerning middle school students. Individual counseling is available to all students as needed, and group counseling is offered when a group of students with similar needs presents itself. The school district of Arcadia has 4 community counselor partners coming into the buildings to offer individual services to students. This allows for mental health resources to be available to students during the school day without having to leave school or parents having to take time off work to take them to appointments. Remote learners can contact me at any time or let a teacher or parents know if they are in need of counseling services. I would set up a phone call or a Google Meet with them to evaluate their needs. Please contact me at any time with any questions or concerns. Thank you.
Hello, my name is Lee Vang and I'm the Arcadia High School counselor. You can call me or email me anytime. My information can be found on the district website. Mental health services that are offered at the high school include individual counseling. I have an open door policy where students can walk in and see me or make an appointment. Topics that I cover with students varies depending on depression, anxiety, and school difficulties. Group counseling is also available as well with that. Topics also depend on what is highly needed. I offer academic counseling as well too, to advise and support students in navigating their career pathways for success. In 9th grade, students have health class, which dives into physical, mental, and social well-being. The class helps students to understand their choices and attitudes that affects their health. Remote learners, they can fill out a Google form to meet with me, or I can call them with any questions or concerns that they have. And then the high school, we have 4 community counselor partners who offer individual services to students at our school. This allows for mental health resources to be available to students during the school day without having to leave school or parents having to take time off to attend appointments. Thank you.
Hi, my name is Hilary Walters. I am the elementary school counselor at Blair Taylor. At the elementary, the counseling program focuses on building students' knowledge, skills, and behaviors so that they can have a solid foundation for their academic, social, emotional, and career readiness. This work is done through whole group wellness classes. I do small group counseling, and also I meet with individual students as needed.
Hi, my name is Sarah Kais, and I'm the middle school counselor here at Blair Taylor. So I work with 6th, 7th, and 8th grade students. With 6th grade students, I teach wellness courses, which means that we talk about everything from responsibility and different characteristics and different traits to learning about our bodies and how we interact with others. With our 7th and 8th graders, I work on academic and career planning as well. So we are learning more about careers and what we are interested in so that we are able to, take courses as we go along that will help us reach our career goals. We also do some sort of academic stuff and some social emotional learning. So I meet with students regularly and I work on different problems that they might be experiencing, and I work to help them create relationships with peers and teachers.
Hey, I am Colvin Schindel. I am the high school counselor here at Blair Taylor. I work with 9th through 12th graders, and I do a majority of scheduling, getting ready for college and career readiness, meet with students as needed by on an individual basis, do groups together, work on scholarships and get them ready for college, work in college applications, and just getting them ready for the future to make them better prepared adults.
Hi, I'm Katie Baylitz. I'm the mental health coordinator, school psychologist here at Blair Taylor School District. Some of the things that we do as a district here at Blair Taylor are that we do social emotional screening for our students in 3rd, 6th, and 8th grades. So we're able to see where the students might benefit from more help and help provide that support for them. We're also able to help by helping students get some of the social and emotional resources that they need through outside counseling. We do have peace of mind counseling that comes into the school district, as well as we have a connection to resources and independence to help students meet some of those counseling needs. We also do suicide prevention training here in the district for our middle schoolers and our high schoolers.
Another thing that Blair Taylor offers is the virtual calming room, which is available to all students. The district calming room has drop-down menus of all kinds of different areas in order to support students, staff, and families to help focus their mind, reduce anxiety, and find a sense of calm in our hectic lives. So this varies from visual relaxation, mindfulness, to journaling. There's many different opportunities on here. If you have an elementary student, please ask them to show this to you, as they've been working on this in their wellness classes.
The Independent School District is committed to supporting the mental health needs of our students. We incorporate many supports throughout our daily activities for all students, which include PBIS, providing a safe and caring environment with clear behavioral expectations, second step curriculum for the elementary students, character strong lessons for the middle school and high school students, mental health and suicide prevention units in 6th grade and the high school health class, staff members trained in trauma-sensitive schools, which emphasizes creating a school climate that is sensitive and supportive to the needs of all students. In addition to the supports incorporated into our daily activities for all students, we also have additional resources for students in need, including individual short-term counseling for students, referrals to and assistance with contacting crisis hotlines, peace of mind counseling services offered within the school building, referrals to outside providers such as counseling or day treatment options, and we are working to set up telehealth or virtual counseling options. Students and families are encouraged to reach out to any staff member they feel comfortable with if they have any concerns, regardless of whether the student is learning face-to-face or virtually. Mrs. Wycheck, our K-12 counselor, and Mrs. Gruber, our mental health coordinator, are available to assist families with navigating mental health concerns. Please call 715-985-3172 if you would like to speak with Mrs. Wycheck or Mrs. Gruber. Thank you.
This is a mental health training that is abbreviated from what has been shared out with staff. In the mental health training, so why should we talk about youth mental health? Well, 20% of children are diagnosed with a mental health disorder. And of those 20%, anxiety is the most common mental health disorder amongst school-age children. Depression and anxiety rates have increased in youth over time, and 22% of children living below the federal poverty level has a mental, behavioral, or developmental disorder. So when you think about that, in a classroom, that would be about 1 or 2 in every 10 students that are diagnosed with a mental health disorder. So when we look at the onset of depression, anxiety, and behavioral disorders by age, can look at depression. The typical onset is between the ages of 12 and 17. For anxiety, again, 12 and 17, but we're seeing it younger in students between the ages of 6 and 11. And then behavioral disorders, 6 and 11 is the most common, but you're also seeing it in the ages of 3 to 5 and 12 to 17. So what are some signs of anxiety? What are some things that we should be looking for? Some things are avoidance of situations or different things that could involve not wanting to come to school, not wanting to go out and do different things. Could be obsessive or compulsive behavior, so having to do the same things over and over again, or not being able to get over something when it happens, showing distress in social situations, not liking when they're around large crowds of people, being nervous or feeling on edge, And nervous looks different for different people. It could be having those butterflies in the stomach, could be bouncing their legs, or having that nervous energy. Could look like irritability, so grumpiness, or just some more anger. It could be unrealistic or excessive fear or worry. So having fear or worry about things that might not be worth having that extensive amount of worry over. Having chest pain or stomach pain, some of those more physical pains. Being restless or shaky. Being fearful of asking questions or be more demanding of teacher or parent time and questions. And complaining of unexplained pains or illnesses. So my stomach hurts, I feel like I'm gonna throw up. So we do know that 1 out of 4 students has a panic attack at some stage of their life. So it's important to know about panic attacks. And this is a sudden onset of intense apprehension, fear, or terror. It's an intensity of fear that is inappropriate for the circumstances. And it can appear similar to a heart attack or asthma attack. And you can see the little guy, cartoon guy here on the image, where he has a sense of dread, choking, that rapid heartbeat. He's shaky, he's got wobbly legs, he feels faint. So what should you do if your child is having a panic attack? Well, first of all, help them into a supported sitting position, like against a wall or in a chair. If they lose consciousness, please apply physical first aid principles and call 911. If the young person recognizes symptoms as a panic attack, ask if you can support them. Help keep the person calm. Speak to the person in a reaffirming but calm manner. Reassure them that they are having a panic attack. Remain calm yourself. Be patient. Speak clearly and slowly with short sentences. Acknowledge that the terror feels real, but the child is safe and the symptoms will pass. So, as we said, another area is depression. And so some signs of depression are an unusually sad mood, loss of enjoyment in interests and activities, especially activities that the child has enjoyed in the past. Overall tiredness and lack of energy, feeling worthless and guilty, like no one likes me, or over apologizing, difficulty concentrating or making decisions, so having trouble following different things, maybe asking why a lot more. Could look like sleeping difficulties, having trouble sleeping at night or sleeping too much, showing a decline in grades or in their academics, failing to engage in class discussions or even discussions at home, like around the dinner table, and snapping at or starting fights with other students or other siblings. So algae is something that we use when we're looking at suicide or students with depression, and it stands for A is assess for risk of suicide or harm. So when we're listening or talking to the child, is there a risk of suicide or harm? L is for listening. This is non-judgmentally, you're just there to listen at that time. G is for giving reassurance and information. E is for encourage, so appropriate professional help. And E is also for encourage self-help and other support strategies. Some of these strategies might look like listening to calming music, following meditation activities, taking deep breaths. So why should we be talking about youth suicide? So suicide is the 3rd leading cause of death in adolescents in the US and the 2nd leading cause of death in Wisconsin. There are 50 to 200 attempts for every completion, and almost 7% of high school students report making a suicide attempt, and over 14% of high school students report suicidal thoughts. There are 11 youth suicides a day, and every 2 hours and 11 minutes, a person dies by completing suicide. So some of the characteristics of suicide: is that it's seen as an alternate to what is seen as an unsolvable problem. The child is thinking in a crisis mode at the time, and it's considered to be a means of communication. So some risk factors are demographics, psychiatric history, drug or alcohol abuse, previous suicide attempts, a family history of suicide, being exposed to another suicide, experiencing stressful factors or stressful events, personality factors, and access to means. And means in this case means to commit suicide. So some of the warning signs are suicidal ideation, so thinking about it, substance use, feeling purposeless or like there's no reason for them to be around, feeling anxiety, feeling trapped in a situation, having a hopelessness, there's no hope for the future, withdrawing from friends, from activities that they enjoy, being angry, being more reckless, doing things that they wouldn't do, and also mood changes, different from how they had been in the past. So when you're talking with your child, listen to them, non-judgmentally. Listen to the words they're saying and how they're saying them. Know your limits. Know that you're not going to be able to solve everything, but also know your resources. At the end of this, we'll share a list of resources for you, and these will also be linked on the school district websites. Also, you can always talk to the mental health coordinators at your districts for more information. Ask directly your child. Ask them, are you thinking about suicide? Are you thinking about killing yourself? And then follow up based on what they say.
So thank you again, parents, for joining us. If there's anything that any of us in the pupil services team can do to help you meet the mental health needs of your child, or if you have any questions about any of the material in general, please feel free to call one of the school counselors or Courtney or myself. And again, we will be posting this information on our district website. So thanks and have a great day.